During the consultation, I often have a conversation with patients about the goals, improvement versus perfection. My goal as a surgeon is to address the patient's concerns by giving them an improvement in their appearance. It's incumbent on me to also describe to a patient the limitations of a procedure. It's important for patients to understand that my goal is only to take a patient 1 or 2 levels over where they're at now, and that's improvement. Patients always look better than had they not had the procedure. Patients have to have realistic expectations when they come here, and so we have a very honest conversation about what the limitations of the procedure are and what the expected goals of the operation are. One of the other things that we discuss during the consultation process is facial asymmetry. And I oftentimes have conversations with patients about the fact that the body, including the face, is not symmetric. One side of the face is different as compared to the other side. One side of the face is usually higher, one side is more prominent, and every structure within the face falls into that asymmetry. So we often talk about the fact that surgery really is not intended to correct asymmetry unless the facial asymmetry is very disfiguring. If that's the case, then we can always talk about improving a facial asymmetry, but I always strive to explain to patients that their face will never be symmetric. And that's just a fact of the way that the face forms. One of the many questions I get during the consultation process is how long a procedure will last. And I oftentimes tell patients that with regards to aging face procedures, results will last 10 to 15 years. Therefore, our goal with an aging face procedure is to turn the clock back 10 to 15 years, and we achieve that. However, because we don't age in a vacuum, and we are continuously exposed to the forces of aging, gravity and volume loss, we're going to continue to age after the operation. And so those results typically take about 10 to 15 years to manifest. In the case of other procedures such as nasal surgery or cosmetic nasal surgery or reshaping ear surgery or otoplasty, those results are permanent. In other words, typically the appearance stays around for a very long time. Even though those areas, the nose and the ears, age, they typically don't age as quickly as the other parts of the face. So those results have a tendency to last much, much longer.